Good afternoon, and thank you for being here. I'm Dr. Kelly Weidenbach. I'm the Executive Director of the Adams County Health Department. Today's hearing addressed important legal questions that are now before the court. We respect the judicial process, and because this matter remains in litigation, I will not comment on specific legal arguments presented today. What still remains unresolved here is our ability to investigate a confirmed case of active tuberculosis that's been widely reported over the summer. We believe we have the legal right to investigate, and we believe our residents support this kind of comprehensive disease control irrespective of the setting in which it is occurring. In that light, we want to provide an update on what has happened in our investigation since the beginning, where we are, and what we remain committed to doing. The Adams County Health Department opened this investigation on June 11th following a notification of a case of suspected tuberculosis. That same day, our medical partners at Denver Health Tuberculosis Program immediately provided clinical advice and medical recommendations to GEO. And our health department initiated its communicable disease investigation responsibilities. This case was found to be laboratory confirmed on June 22nd via third-party laboratory. And our teams moved very quickly. As part of our investigation, we followed our routine protocols by requesting medical records, an interview with the individual, access to certain areas of the facility where the individual had been housed, and complete information about people who may have been exposed, including detainees, staff, and visitors. Those requests are routine and necessary components of any thorough tuberculosis contact investigation. Over the course of this investigation, we have worked closely with our partners at the Colorado Department of Public Health and Environment and our Denver Health Tuberculosis Program. Collectively, we have provided clinical guidance, attempted to interview the case patient and potential contacts, developed the contact investigation framework, and repeatedly sought the medical and epidemiologic information needed to protect potentially affected individuals. Our staff and legal counsel have devoted substantial amount of time and expertise on this investigation. When voluntary cooperation did not provide the information necessary to complete the investigation, the Adams County Health Department issued a public health order on June 25th to require compliance. Even after issuing that order, we continue to try to establish a workable pathway to complete the investigation. Every day that the facility has delayed compliance means more potential for people's health to be needlessly put at risk. We also sought help beyond the local level. The Adams County Health Department, CDPHE, and Denver Health engaged with tuberculosis and special population experts at the U.S. Centers for Disease Control and Prevention, as well as medical officials with the Department of Homeland Security, in an effort to resolve the barriers and obtain appropriate public health access and information. Those discussions continued over multiple exchanges, but the contact investigation remained unresolved. In all cases, the ask remains the same. Allow us access to records, not to assign blame, but to verify that the threat is no longer active and proper protocols were followed. On July 14th, CDPHE subsequently issued its own written request seeking the same records, contact tracing information, and facility access that Adams County Health Department had requested. From the beginning, our requests have been straightforward, routine, and based on long-standing public health practice. Every year, local public health departments conduct communicable disease investigations involving hospitals, schools, nursing homes, correctional facilities, businesses, shelters, and other congregate settings, to protect residents and stop the spread of disease, not to assign blame or to play politics. These investigations are not unusual. They are a fundamental responsibility of any local public health agency. As this case proceeds, we hope that long-standing authority to investigate and control disease will be upheld by courts. We understand that our community has questions and shares deep concerns about this situation. We share those concerns. Our commitment remains. We will continue pursuing every appropriate avenue available under the law to protect public health and safety of our residents, both now and to the future. Thank you so much. We'll take some questions.
So I wasn't in there for an hour. What happened in the courtroom? Just tell me what happened in the courtroom.
In the courtroom today, the court heard hearing regarding the implementation of House Bill 1276.
For an hour? What happened during the complete hour? I mean,
what's your assessment of the overall hearing today?
I cannot comment about the premises of the case or any of the active litigation.
Dr. Weidenbach, you guys issued that public order, so what's next? Is it just a means of waiting for more communication between the GEO group and ICE, Adams County, CDPHE? What can you do?
Right now we are still in communication. We really appreciate our partnership with CDPHE and our legal counsel and other partners that we're still continuing to examine what our enforcement strategies might be.
Dr. Weidenbach, I stopped you in the post. So why haven't you taken them to court? Are you figuring out if you can? Or it's been a month.
I think some of the legal arguments in this particular case were pertinent to our authority. So we have been waiting for this hearing to happen.
So does that mean you're waiting for a ruling in some way in this, or some level of a determination from this?
We'll be discussing that with our legal counsel.
Do you have a sense the person who was a confirmed case? Do you know Do you know where they contracted TB? Was it in detention, outside of it?
Based on incubation period of tuberculosis, we do not believe that the individual contracted the infection in the facility.
Okay. Do you suspect that there was local transmission in the facility?
At this point, we do not have any information to make that determination at all.
Jocelyn from Telemundo. So right now you're kind of just in the waiting process. So does that mean that we don't have like a timeline of when we'll know what proceeds after this? We're just kind of just waiting?
I wouldn't say we're waiting. There's a lot of discussions happening with the State Health Department and our legal counsel regarding what our options are.
What's your big picture concern here from a health perspective, both for the people inside and the broader spread and potentially spread outside of the facility?
I think what makes this case different from previous communicable disease investigations is just the fact that the facility has gone completely quiet and is not communicating whatsoever, which is different than previous situations that we've been in.
How can you know what's going on in there if they're not communicating to you?
We cannot know. Yeah, we don't know what's going on in the facility without that communication and cooperation.
As one example, right now have other problem, the conjunctivitis in different rooms. My other problem, the bad infection in the feet, the different person there. I'm the first person, I'm the news public, the TB cases. It's very important, continue work together. Every time listen the first voice, the detainers, what happened inside. I'm there different time. And witness everything what happened there. It's very important at the time the health department receive claims is really moving to investigation. This is my job, support my community and save lives. Obviously the health department same is your responsibility is investigate and save lives there. This is very important, continue this situation in courts. The GEO no need exception, regulation or investigations. It's very important. Continue work together. Every time I listen something, what happened inside for medical problems, I'm sending you claims for continue this investigation.
I believe we have the same goals in terms of just wanting to protect the health and safety of individuals within the facility, including detainees, employees, visitors,
Yes.
all those things.
Thank you.
Dr. Weidenbach, when was the communication breakdown? When did that stop happening?
Stand closer.
I'm trying to think. The end of June is when they completely quit communicating with us and quit responding to communication and requests.
And is that the GEO group and ICE?
Correct. We have not received communication from either entity
Since then?
since then. Yes.
Of any kind, we're talking phone calls, emails, I don't know how you usually
Correct.
communicate
Yeah,
with them. But
correct. Yep. All forms.
so this was a public hearing. The public could attend it. Yes.
Yes.
So as a member of the public, I just want you to describe what took place today. I mean, you don't have to get into anything you don't want to get into, but can you just tell me what happened or what you guys? it's a public hearing. So can I just get an idea of what happens?
Sure. This was a motion hearing in which GEO Group sued state public health officials and also myself as a local public health official regarding the implementation of House Bill 1276, which has to do with requirements for the federal detention facility.
And how'd it go?
Both sides made their legal arguments, and then the judge will be coming back with a decision in the next few weeks, we expect.
And on the court case, it seems like there was an argument there that that GEO is trying to use this state law as a way to, I don't know how you put it, but maybe invalidate local public health's ability to go in there and investigate. Am I putting that correctly? Is that part of what's at stake here? I mean, this is happening on two tracks. You've got the state law and you've got the TB case, but is it true that it seems like they're trying to use the court case to invalidate, or do you see it that way, Adams County's ability or responsibility to investigate communicable disease inside the facility?
I appreciate that question, and I cannot speculate what they're trying to do, but I do believe that we've had those concerns that that there is a desire to avoid complying with pre-existing law that existed before House Bill 1276, and there were arguments made today that those laws are pre-existing and upstanding, but we know that they are not in compliance with those laws at this moment.
Do you have any other active health investigations in the GEO? Is there anything else you guys are looking to do there?
We do not have currently any other active investigations.
Big picture, what's at stake here? I mean, we've got cases like this all over the country. I've heard Washington, I think New Jersey as well. I mean, does this have implications for Colorado beyond just Aurora and for even beyond that?
I believe the case really gets into just the enforceability of public health, state and local public health laws as it relates to federal detention facilities. So that may have implications in other states, not so much public health law in a more broad sense.
During that hearing, Dr. Weidenbach, we heard that there has been at least one inspection at the Aurora ICE Processing Center so far this year. Were those public health officials with Adams County Health Department or CDPHE?
Both of our organizations inspect various aspects of the facility. So I do not remember the last time our inspectors were in the facility, but we inspect their kitchens and their food service.
Do you remember if your inspectors were in there at all this year so far?
I'm sorry, I cannot remember that. Yeah.
What is the last time have inspection there?
I would have to look that up. I would have to get back to you all.
But when you do the inspections, are you able to talk to detainees? Are you able to, in a case like this, under normal circumstances, what would that look like? Would you be able to talk to a number of people? Would you be able to conduct your own tests, etc.?
So I'll address two different aspects of your question. The first one around just our kitchen inspections. We have not historically been prevented from going into the facility to conduct those inspections. Most of the time, our staff are interacting with GEO Group staff and not interacting with the detainees to conduct the kitchen inspection. In a normal communicable disease investigation, we may be interviewing like people who have tested positive for communicable disease and their contacts. So that might include in-person interviews or video or phone interviews. And obviously in this case with tuberculosis being an airborne disease, it's not uncommon for us to want to go into the facility to assess ventilation, air movement, and other aspects of the environment in which might promote the spread of the infection.
And one question about TB, what would you like the public to understand? Why is TB bad?
Right. Tuberculosis is a very serious respiratory infection, and very severe cases can lead to death. It's a infection that has a high fatality rate if left untreated. It's also it's an infection that has a long incubation period. So many times people are exposed, and it may take months to years before they develop active symptoms and active disease. So it's something that when we identify a case, we want to understand who's been in contact with that case so that we can test them, establish a baseline test, and then the protocols call that we test them again 8 to 10 weeks later. And then if they convert into a positive, which means they would likely be a latent case of tuberculosis, so not infectious but infected and could potentially become active tuberculosis later, we want to treat them right then and there because it prevents them from getting the active case or active disease, and then it also prevents them from spreading it to other people.
In this case, was it an active case? Was the patient symptomatic?
This case patient was found to have, through laboratory evidence, active tuberculosis,
Do you know if
meaning
they were,
infectious tuberculosis.
Do you know if they were symptomatic? Like they reported feelings?
This particular case patient denied symptoms, but that does not mean that the person was not infectious to others.
Do you know anything about what happened to that person? GEO said, or ICE says that they've been removed. I think was the language they used. Do you know
Remove the
where they might be or what's happened to them?
I believe we have the same information that you all have from ICE statements to Congressman Jason Crow's office, is that the individual was treated and deported.
Yes.
And we have no way to verify that. So at this time, we don't know where that individual is.
Yeah, but the other active cases continue there. It's just that they remove other two as the very sick people.
If we're seeing, Jasmine, CBS Colorado, if we're seeing that this is an issue inside the detention center, how is it an issue and a threat to the public? Can you explain that, why it's so important that you're all trusting GEO to allow you to inspect?
Sure, absolutely. So in this particular situation, we believe the person to have been infected with tuberculosis before they entered the facility. So in that case, we are concerned about exposures that other people may have had to this individual before this person was brought into the detention facility. We also know in that facility, it's a large facility, and we have employees, we have visitors, legal counsel for detainees, and many other different people, contractors, delivery people, all sorts of people coming in and out of the facility. And then, detainees themselves are often issued back out into our community, and we are all connected in some way, through community contacts.
Thank you.
Thank you so much.
Thanks so much.